Hi, this is Chris Madsen, and I'm an associate professor in the departments of Public Health Nutrition and our Joint Medical Program at UC Berkeley in the School of Public Health. I'll talk really briefly, give you a little background today, and then talk about tax pass-through results, sugar sweetened beverage, or SSB, I'm going to call it SSB throughout, consumption results, and finally, business and revenue results. Just so we're all on the same page, the structure of an excise tax is that it's actually levied on distributors. So it's the distributor, the bottler, or large beverage industry that pays the tax. And they're expected to pass that tax on to the retailer through higher prices. The retailer is then expected to increase the shelf price of the product, and this is called tax pass-through. And it's that pass-through that we assume will reduce sugar-sweetened beverage consumption among consumers. I'm going to focus today on 3 jurisdictions with new data on tax impacts. So these 3 places had varying levels of tax. You can see here that the effective price increase ranged from 6% in France to 16% in Berkeley, and they were all implemented within the last 5 years. An important note in the background that the data sources for these studies are heterogeneous. So there are really there's no single way of getting at shelf prices. For example, there are many stores, some are registered on retail scanner data, for example, or on websites, and some are not. So lots of different sources for data, and all of these sources of data have been used for shelf prices across the studies I'll cite today. Consumption, similar, there is not a gold standard. You reach different consumers through different approaches. So just keep that in mind as we talk about the results. First, tax pass-through. So all 3 jurisdictions had assessments of pass-through sometime between 6 months and 1 year. Berkeley, we can see, had 2 assessments actually at 3 months and 1 year. And importantly, for regular soda, which is the type of SSB that is most frequently consumed, the tax was fully passed through. So at least, and sometimes more than 100% of the price the distributors were paying was passed through to the shelf price. In Berkeley, at 3 months, it had not quite been passed through, but by a year, it had been more than fully passed through. Fruit-flavored drinks, which are, fruit drinks where there's added sugar, had incomplete pass-through, between 50% and almost full pass-through, and untaxed drinks showed almost no change. Untaxed drinks are important because it's the relative price increase that we expect to drive change. So if untaxed drinks were to increase in price, even as taxed drinks increased in prices, we would expect a smaller impact. So I noted that there was heterogeneity in the level of pass-through by beverage type, with regular soda tax being fully pass-through and fruit-flavored drinks having partial pass-through. There was also heterogeneity by store type, by distributor, by brand, and by region. And the implications of the heterogeneity is that you may have lesser or differential impact of an SSB tax if pass-through is incomplete for some or all products, if untaxed beverage prices increase, and if there are regional differences in price or in pass-through. And some of the things to consider as people are writing taxes or working to implement taxes: retailer outreach and education about where the tax is really being levied, particularly for small retailers who may not realize which beverages are actually costing them more if they don't have a strong system of organization. And price regulations are something else that could be considered if it's very important to make sure that the less healthy beverages remain higher in price. In terms of SSB consumption, so France, the first country to pass a tax for which we now have good data, and this is extremely recent data, and one of the things I want to note is these are preliminary results, and Dr. Capacci, who was willing to allow me to share these results, did note that they may change because this is from a working paper. Her data came from HomeScan from Europanel. So HomeScan data are where customers agree to record all of their purchases, either with a scanner that they have at home or by actually keeping a track of what they've purchased. They had 3,000 households in France and 400 households in Italy. The timing for their data, they had 1 year of pre-data and 1 year of post-tax data. And they used a difference in differences model where they compared the change in France before and after the tax to the change over the similar time period in Italy. And what they found in the first year after the tax was a large decrease in household purchases of regular soda, 25% decline, a 15% decline in fruit-flavored drinks, and a 10% increase in untaxed water. Mexico also used home scan data. This was from Nielsen, and they had just over 6,000 households contributed data to their analysis. You may have seen results from Mexico already at 1 year, but they've just come out with 2-year data as well. So their timing, they had 2 years of pre-tax data and 2 years now of post-tax data. Their model compares predicted purchases to post-tax purchases. So what they did was they took data for the 2 years prior to the tax, and then in 2014, which is the first year in which they implemented their tax, and 2015, the second year, they looked at predicted consumption, and that's the counterfactual. Those are the green lines that are shown here and here in 2015. So that's what we would have predicted that people would consume if they had followed the pre-tax purchasing patterns. These brownish orange lines are the actual volume or the estimated volume based on what the home scan data actually showed. And this is a 6% decline then between what we would have predicted and what was estimated to be actually consumed, and a 10% decline in the second year. Dr. Colchero, who did this work, was able to look at the data as well by socioeconomic level. And she compared the lowest SES tertile to the highest SES tertile. And in each year, the orange bars represent what happened in 2014, and the red bars what happened in 2015, as well as combined, the impact over the 2 years of the tax. We see a much larger reduction in the low SES tertiles as compared to the highest SES tertile. This is important because certainly in developed countries where disease, the burden of disease associated with sugar-sweetened beverage consumption, like diabetes and obesity, is concentrated in lower income neighborhoods and among individuals who are in the lower socioeconomic level. Berkeley, we assessed consumption in 2 different ways. So in Berkeley, in low-income neighborhoods, we conducted 2,600 surveys. And what we see on the map here, this is Berkeley shown in purple, and these are the 2 comparison cities where we collected surveys as well, San Francisco on the peninsula and Oakland. The timing for data collection was May to September in the year pre-tax, and again, May to September in the first year post-tax. This was also a difference in differences model comparing change in Berkeley to change in the comparison cities. So in the first 6 months after Berkeley's tax, we saw a 21% decline in total sugar-sweetened beverages compared to essentially no change in the comparison cities. A 26% decline in regular soda, very similar to what was seen in France. And both our intervention city of Berkeley and the comparison city showed a drop in fruit-flavored drinks, but neither of those were significant. And we did see a large increase in water in both the comparison cities, an increase of 20% and a 63% increase in Berkeley. It's important that I note that 2015, the summer we were collecting data, was actually the hottest summer on record in the San Francisco Bay Area. And we expect that these very large jumps likely reflect in part the weather. But importantly, and this was shown in France, and this is also true in Mexico, this large increase in purchasing of water suggests people are moving from sugar-sweetened beverages to the healthiest alternative, which is water. And this is a really promising impact. We also assessed changes in consumption in Berkeley using purchases. So Lynn Silver's group with Barry Popkin analyzed retail scanner data from 2 large grocery chains. And those 2 grocery chains were able to provide data for 3 stores in Berkeley, as well as 6 stores in comparison cities around the San Francisco Bay Area. They had 2 years of data pre-tax and 1 year of data post-tax. And their model also compared predicted purchases to actual post-tax purchases. This first block over here is actually pre-tax data, and the dotted lines just show the consumption patterns in the comparison cities and Berkeley before the tax was implemented. And the the bumpiness of those lines is typical in all beverage data and mostly reflects promotions that happen and people purchasing based on coupons or sales of soda. The dotted lines continue to represent the counterfactual or predicted purchases. So had people continued their prior purchasing habits, this is what we expect we would have seen for purchasing in the comparison cities, and this dotted line is what we would have thought would happen in Berkeley. And instead what we see were the actual purchases represented by the solid lines, and those purchases represent a 7% increase in the comparison cities and a 10% decline in Berkeley. So the implications from this particular these results in on consumption for sugar-sweetened beverages. First, across very heterogeneous studies, SSB taxes appear to reduce sugar-sweetened beverage consumption, despite the heterogeneity, both in geography and in methods of the study. Regular soda consumption declines the most compared to other sugar-sweetened beverages. And individuals in low-income communities appear more likely to reduce their consumption. Now, this last point is important because one of the concerns that the beverage industry has raised about sugar-sweetened beverage taxes is, and the public health community has also raised this concern, is that taxes may be regressive. So this was a billboard paid for by the beverage industry that was opposing the very first tax proposed in a city, which was back in 2012. It did not pass. But the Richmond beverage tax is unfair. It hits poor and working people the hardest. So the fact that individuals in low-income neighborhoods may choose to stop buying sugar-sweetened beverages means they're not burdened by the tax, but they are most likely to benefit from any of the health effects that result from reduced sugar-sweetened beverage consumption. So this is an important finding that can address one of the concerns that's been raised. So when we think about business and revenue and the impacts of sugar-sweetened beverage taxes, the beverage industry has also raised concerns that these taxes can hurt small businesses. This was also a poster back from 2012 in the first campaign in Richmond. And then here's a poster from the campaign in Oakland and San Francisco that was in the summer of 2016. And this says, "The grocery tax hurts my customers." So certainly the beverage industry has been concerned that if taxes are applied and the price of their product goes up and people consume less, they won't be able to employ as many people. But what we've been able to see from some of the earliest data that's come out on, this is based on the retail scanner data that Dr. Silver and Popkin used for the study of Berkeley's tax. They found that from these 2 chain grocery stores, there was no decrease in store revenue in Berkeley relative to comparison cities because people bought different beverages rather than decreasing their total beverage purchases. And for grocery bills, there was no increase for consumers. So despite an increase in the cost of sugar-sweetened beverages, people's overall grocery bills did not go up. Food sector jobs actually increased by 7%. So this is data that comes from Berkeley's Office of Economic Development and showed that across the food sector industry, there were significant jobs added in Berkeley in the year following the tax. Similarly, food sector revenue increased by 15%. So these bars are looking at various sectors: general retail, food products, transportation, construction, business to business. The food sector revenue actually showed the largest increase relative to other business sectors. So across the United States, we have tried to enact a soda tax at the national level without success. We have tried multiple times to enact a soda tax in California without success. But we have now had success in a number of cities and counties enacting taxes, and this is just a quick snapshot of some of the most recent ones. By the way, Seattle passed its tax earlier this month. And tax revenues, so Berkeley in its first year raised $1.5 million. And this is, Berkeley's a very small city of about 100,000. Philadelphia raised $6 million in the first month of the tax, and they are on their way to exceed their expected annual revenue, which they had predicted to be $50 million. In the U.S., cities have chosen to use their tax revenue for very different purposes. Berkeley is dedicating all of its taxes, all the revenue to child health, whether that's through the schools, which have received a large chunk of funding, or to community organizations that also work on child health. Philadelphia is dedicating its tax to early childhood education to help meet a budget deficit in that area of need. Seattle, which just passed its tax but hasn't yet implemented, this is in Washington state, they plan to use their funding to close the education achievement gap. So very diverse purposes for and uses of the tax revenues that are adapted to the individual needs of the communities passing those taxes. So additional implications then of sugar-sweetened beverage taxes. First, early evidence suggests that there are no harms to job or retailer revenues. Second, SSB taxes generate significant revenues for public use. There are clearly many additional areas for inquiry, and I'm sure that these have been discussed today and will continue to be discussed, but just briefly, reducing the heterogeneity of pass-through, so making sure that retailers understand why the tax is enacted and the hope for the tax being fully passed through and only to the less healthy items. Assessing substitution, and this is, do people always choose to drink water instead, or do they, if they stop buying sugar-sweetened beverages, do they replace that with either potentially high-calorie drinks or with junk food or other types of sweetened product? Assessing cross-border purchasing. We did see in Berkeley that there tended to be higher purchases in neighboring community stores, so that people might leave Berkeley to go to another store. If you enact a countrywide or a countywide tax, that can be helpful because people are not as likely to try and purchase their drinks somewhere else. The impact on equity. So I touched on the potentially regressive nature of taxes and, frankly, the regressive nature of diabetes and disease in low-income communities. And I think we do need to give great thought to how best to really create greater equity in these communities, not just through taxes. We can fortunately begin to study the impact of different tax levels. So I noted that these taxes ranged from about an effective price increase of 6% to 16%. But Boulder, Colorado just implemented a 2-cent per ounce tax, which is equivalent probably to about a 30% increase. So it'll be very interesting to follow what these price differences mean. And of course, one of the most important things is the long-term health impacts. How does the tax itself and the reduction in sugar-sweetened beverage consumption, as well as the revenues being used to create healthier communities, actually impact long-term health? And of course, the final question, what's going to happen in New Zealand? Thank you very much.